Hi nurses, in this video we are going to review how to properly discharge a patient from the tracker when they are going to the OR. So if a patient is going to the OR, you're going to open their chart, and on your work list by hitting add, you would search for pre-op, and you can see here mine's low lit because it's already on my work list, but you would add your pre-op checklist and then it will be on your work list and you can complete it by documenting it. The OR can see everything that is documented here. Once the patient is ready to go, and now you need to remove them off your tracker, you're going to go to the Discharge Plan tab with the open chart. And then if the patient has not had a disposition chosen by the doctor, you can click Still a Patient because the patient at this point would still be a patient. And you would hit the ED Discharge Assessment, hit Document, and the only thing you would complete is their condition and that they were going sent to OR. Same thing you would do if the patient was admitted upstairs, etc. You would hit Save and Exit, and then you will not, so once again, will not enter a discharge date and time. You cannot enter a discharge date and time for an OR patient, otherwise the OR cannot access the record. So you just do your ED discharge assessment, you hit Save. This will save your discharge assessment, and then you click your tracker to go back. And you will click on the status column. So this column here, you'll click on the status, so whether it says MD done or bed reserved, etc., and you hit sent to OR. And this is going to say this is a final status, continue. This is the same exact thing we had in the old system in Magic. This drops them off the tracker, so now you can see test ARLA is gone. And this is how you can get the patient off of your tracker without discharging them, because if you discharge them, now the record can't be accessed. So you never want to enter a depart date and time for someone going to the OR. If they're going home, meaning they're discharged, a regular patient going home, you enter a discharge date and time, and if they're being admitted, you still enter a discharge date and time. Just remember, with admitted patients, if you cannot enter a discharge date and time, it's because the unit clerk has to transfer the patient first. So have the unit clerk transfer the patient to the correct unit, and then you can go and enter your discharge date and time to drop them off your tracker. The other reminder I want to go over is your transfer orders. So see this yellow flag? Don't get confused with the word transfer. All the yellow flag means is that you have admission orders on your patient. So it's like your hospitalist wrote your orders for you, but they're computerized now. So you would treat them the same as your admission orders. You don't have to do anything with them unless your patient is a hold. You do need to have transfer orders for ICU patients because it's like in the old system. They can't go up without admission orders. Because you know how on like gen med patients we can put in holding orders, ICU must have the admission orders. If your patient is going to be a hold, then you would click this yellow flag. It's going to say a pending transfer exists on the patient, and you normally would go to current orders. You can open your chart. If you're going to activate the orders, you go to transfer orders. Just please make sure you don't activate these orders on accident, because otherwise it messes up how the providers can put in orders. So you only activate these orders if your patient's going to be a hold, even if they're ICU. If the doctors need something done now, when they enter the transfer orders, they have a way of hitting now, and those orders will process onto the ED tracker. So you don't have to process the transfer just because they're an ICU patient or you need something. The doctors have a way of making those orders now. So if the patient is a hold, meaning they're not going upstairs, you would do your inpatient documentation. If they're an ICU patient, then you would do your critical care flow sheet, and you would process your orders. So you would click whoever the admitting doctor is. So let's pretend it's Dr. Day, and then you just click clinical pathway and protocol. It's just giving a source of who gave the orders. This is going to take you to the transfer queue, and you can tell because see how transfer orders lights up? The nurse would do nothing. You're not going to click any button except for this button right here, the process transfer. So you would click process transfer, and this, once you hit it, and I'm not going to do it in this test scenario, but it would make all your orders go active so that you would now have your labs when they need to be done, your meds when they need to be done, your any orders when they need to be done, a diet, etc. So it would make all of these things go active at the correct times. You wouldn't be doing everything right now. It would just be your meds would get ordered as they needed upstairs. It's the same thing the nurses upstairs use to take care of their patients. So that's why you only do it when it's a hold.